Just ahead on Black Issues Forum, a deep dive into Biden's Build Back Better plan and what could make it a happy new year if it passes. And someone's got the memo as we are seeing more Black Santas. What do you make of it? Stay with us. Welcome to Black Issues Forum. I'm Deborah Holt-Noel. As we near the end of 2021, a deal to seal President Biden's Build Back Better plan is closing in. Today, we're taking a deep dive into a few key areas of the social policy and climate change bill. And I'd like to welcome Senator Natalie Murdock of Durham, Dr. Mark Little, an economist and executive director of CREATE at the UNC Keenan School of Private Enterprise, and political analyst Steve Rao. But first, when Congresswoman Alma Adams addressed the House on this piece of legislation back in November, here's what she shared about some of the direct impacts for North Carolina.
It extends the child care credit for a year, cutting child poverty in half. In North Carolina, that's a lifeline for hundreds of thousands of children who go to bed hungry every night. It puts $150 billion towards affordable housing, which has been described as the single largest and most comprehensive investment in affordable housing in history. In Charlotte, so many other communities across the country, that's real progress on our affordable housing crisis and real relief for over 500,000 Americans who don't have a roof over their heads.
Let me open up with you, Senator Murdock. How indeed can this possibly cut child poverty in half, as Representative Adams said?
Absolutely. Thank you so much, Deborah. And I also would be remiss if I didn't just thank Congresswoman Adams for her leadership on this topic. It will, in fact, some studies show it has already, the current child tax credit that was already extended has already reduced child poverty upwards of 40%. But since I also did work with the Congresswoman on Black maternal health legislation here in North Carolina, also have to add it will provide robust once-in-a-lifetime funding for Black maternal health issues. But child poverty is something that we don't talk enough about, and that is one of the many huge benefits of Build Back Better, which is why we're all anxiously awaiting for the Senate to move forward with this legislation. We've all seen gas prices going up, inflation, the cost of everything is going up, so I can't think of a better time for us to provide parents with $300 to $3,600, depending on the age of their child, with that tax credit, and also additional assistance with health care will also reduce the overall cost to these households, which will really help to reduce childhood poverty and pull entire households out of poverty for the long term.
And once again, taking a look at some of the key provisions of this $1.75 trillion social infrastructure bill. If passed, it would mean $555 billion for climate change, $400 billion for universal pre-K, $200 billion for child tax credits, as Senator Murdock was talking about, $200 billion for 4 weeks of paid leave, $165 billion for health care spending, and $150 billion to expand affordable home care, and $150 billion for affordable housing. Now, let me pull you in, Dr. Little, taking a look at some of the key priorities of the $1.75 trillion social infrastructure bill. If passed, it would mean all of these things that we just talked about, but how is this going to really impact Black and Latino and vulnerable communities here in North Carolina? What are some of the specifics?
Yeah, so I think if I could focus on the pre-K a little bit. The thing that's really interesting about this is I think it has opportunity to do two things. One, along the lines of what the senator was saying, people who don't have enough income and wealth in their homes, that they're having to make these decisions, do they pay for childcare or not? They now will have that wealth freed up. The other thing, though, is the people who are working in the pre-K sector are overwhelmingly Black and brown people as compared to K through 12 education. And so by bringing that spectrum of work connected with the federal government, there's an opportunity to increase those wages and also an opportunity to create more job opportunities for those folks. And the way that it's structured, there's an opportunity to create more wealth because many of those businesses are actually owned by Black and brown people. And so federal dollars coming to families that have young kids who need childcare, funneling them into this new framework that's coming is going to have, I think, a disproportionately positive impact on those families that need it the most, and those are Black and brown families.
It's so helpful to understand exactly how this spending would actually work and be in effect. Steve, let me get you in on here. Is this an area of partisan contention? Is this something that's being debated, or are people, are legislators pretty much on board and together on this aspect of the bill?
Well, I think the biggest Republican contention, across the country is just the amount of money that this bill would put in, and would it, contribute to continued rising prices, inflation. I think, in the most part, people are, getting to the point where they see the benefits of getting this bill passed, just as they did the infrastructure bill. But, might come back to the Republicans who are continuing to resist this legislation through partisanship, is that I agree with President Biden that there's no greater economic engine than the ingenuity and hard work of the American people. And we have to grow the middle class. And, in India, in China, the middle class is growing. But the middle class and the opportunities for our middle class are shrinking in the United States.
And it's been a long time. It's been a long time since this investment and attention on the middle class has happened. So when there's neglect, or, for a long time, it's no wonder it's going to take a significant infusion and investment of dollars to help Build Back Better. Senator Murdock, another critical component is Build Back Better has some other provisions. Does it fill the gap, and if so, how?
It very much so does. And honestly, I applaud the Biden-Harris administration for making this a signature piece of the Build Back Better Act. And to be clear, our own congressional members here in North Carolina went directly to leadership to say, North Carolina is one, I believe, of 11 states that has failed to expand Medicaid. And so with Build Back Better, we will close that coverage gap. There are over 200,000 some odd North Carolinians that fall in that gap. And earlier we were talking a lot about, middle class, but also those who earn even lower wages find themselves in that gap, because when you combine the income of themselves and their spouse, they may not be eligible currently, but they're still struggling to make ends meet. A lot of us are one medical emergency away from being evicted from our homes. It very much can be the most expensive part of your budget. So those over 200,000 North Carolinians will have the opportunity to be included in the ACA exchange. A lot of their premiums will completely be covered, and enough is enough. As you know, we've reached a budget impasse. We do finally have a budget this year, but we even enter budget negotiations this year, hopeful that in exchange for other things, we could finally expand Medicaid. But I do believe the federal government is very serious about this, and in the event that North Carolina cannot chart a path to Medicaid expansion, they will do it for us. That is why you did see language around a Medicaid study group included in our budget. I do believe that we will come back in short session and return to the table with very serious discussions about Medicaid expansion, knowing that I'm confident that some form of Build Back Better will pass, and that is a key component, and that specific provision is for states like North Carolina that have failed to act so far.
Dr. Little, what are your thoughts about these provisions and how they compare, say, to Medicaid expansion? Sounds like it's a really positive move forward and a good compromise.
Yes, I think given the reluctance, unwillingness of a number of states, I think it's 11 or 12 states, including North Carolina, to expand the benefits, this really is the only option that's there. And as the senator said, it seems to cover almost everything. For example, some of the Medicare-like benefits around transportation that aren't typically on the healthcare marketplace, those kinds of coverage, that will be included for people that will now be covered by this. The only real concern that I have is just around getting people to sign up, and it's just another thing that people have to think about. Am I covered by this? Am I covered by that? My employer, all these, just gets very, very complicated.
So there'll be some bureaucracy involved with this. There'll be some bureaucracy, and you've got to fill this out and go through this application.
And learn about it. So the bill has a significant number of dollars in there to tell people about this new benefit, but it's going to vary by state. And there's also some parts that overlap a little bit. So people are going to have to decide, do they get off of one insurance to get, it just makes it more complicated. But given the unwillingness of certain states to expand benefits that are there for them, this really is, I think, the best that we could hope for it.
It's a move forward as I see it. And, you know, for a long time, there's been debated this question. I'm going to direct it to all three of you, starting with you, Steve. Is health care a right, a privilege, or a responsibility? What are your thoughts on that, Steve?
Well, you know, I think healthcare is a right. I think if you look at the United Nations Human Rights Declaration, it was mentioned as a right there, and you know, our Constitution says that every American citizen is guaranteed life, liberty, and the pursuit of happiness. And I think it's absolutely important and fundamental that we have healthcare so that we can be free, we can live our lives, we can enjoy our times as Americans. So it is a right. And I think it's also a responsibility for us to be accountable for our own health care, but also, you know, in terms of just staying healthy, keeping our immune system strong, healthy diets. But governments also have an obligation or a responsibility to provide those healthy choices for the American people to make sure that we are healthy and we can reduce our healthcare costs. So the answer to your question is yes. Healthcare is a right. In Canada and other nations like England, they're providing it. It would require trade-offs, but I believe this should drive our policy decisions. And I'm glad we have people like Senator Murdock in our state Senate that are pushing to make sure that this right is there for every North Carolinian.
Senator Murdock, it may have already been stated for you, but
Yes. Yes, absolutely. And this is an issue that is near and dear to my heart. My mom is a public health nurse, so I was able to see every day the impact of healthcare and just how it really impacts your everyday life. A small business owner launched my own company in 2017, so I know what it feels like to have to pay for those costs on your own. At one time, I was paying $500 a month for my healthcare coverage, have a specific stomach condition where I need a certain level of medication, so I had to get the type of healthcare coverage that would cover medicine that if I were to pay out of pocket would have been $1,200 for a 3-month supply. And can't tell you how many seniors I talk to that struggle paying for the medical prescription coverage that also has some benefits in Build Back Better. So it is a basic human right. And as Steve mentioned earlier, so many other countries are getting this right. We'll, in a little bit later in the segment, talk about the climate change part of the policy. But when I recently went to Scotland for COP26 and talked to, a young man in London who was in his 30s, unfortunately was diagnosed with brain cancer and had all of that covered. It was covered. He didn't have to stop his life and have the inability to afford his lifestyle because he was diagnosed with brain cancer. So we've got to figure this out here stateside.
Very freeing. Dr. Little, your thoughts on it? Privilege, right, responsibility.
So I think it's actually all of those. And maybe the thing that I want to add here that maybe a little different is the healthcare that we do have. And it's really heavy on machines and drugs that can be expensive and really light on prevention, nutrition, and behavioral interventions. And so the healthcare that we have access to needs to change. And this is beyond this infrastructure bill, but we really need to focus on how do we end disparities in the system itself, and then really focus how do we keep people healthy from birth through the course of their life. And as you may know, life expectancies in the United States have been flat for the past 20 years, before COVID, right? And so we really need to think about what are those things, whether it's opioids, obesity, diabetes, these things that are preventable that really are impacting people, and think about that broader picture.
And the predeterminants of health.
Absolutely.
That hit so many, from birth all the way on up. But when we think about the predeterminants of health, those things, those experiences that happen within your life during those first few years that you're here, they can have a lifelong impact on your health, obesity, mental health, and that feeds into your financial well-being. So that preventative piece is absolutely critical. I would have to agree with you. And we know another major chunk of this legislation that's been provided for is about $555 billion for climate change. Steve, what are some of these provisions and how do they address some of the environmental needs of North Carolinians who are more vulnerable and in those distressed areas?
Well, I think what's really appealing about this part of the bill is the significant tax credits that are provided to provide, assistance for those that are moving and transitioning towards increased energy efficiency. Reducing the cost, for example, for solar rooftops by 30%, reducing the cost of electric vehicles by almost $12,500 for the average American family, just because we're manufacturing these vehicles here, and also tax credits for those as well. And I think just all of the incentives and credits that are there to help those in rural areas of North Carolina to move towards energy efficiency, but most importantly, reducing energy costs, which we've talked about before on the show. Energy prices are rising, utility bills are rising, and people want, they need to have the power on, they need to have the lights on, they need to have their utilities running like water, and this bill does exactly that. And Mr. Little also brought up the point of jobs. And so let's not forget that as we move towards a green economy, we are going to be creating millions of jobs in the U.S., and we want many of those jobs in North Carolina, so that our governor and Chris Chong and the Commerce Department can recruit these new innovations. So I'm excited about that, and I think this is great for the citizens of North Carolina.
Mm-hmm. Dr. Little, help draw a picture for us. So, if this is impacting people in rural areas, we know that there are those high energy bills that can come from not having well-insulated homes, for example. That might be one example, might be the key one, but, draw a picture for us about, how's this really going to work?
Yeah, so I think, as Steve was saying, the solar panel subsidies, I think, are quite important. There are a number of Black homeowners in rural places, and actually in my work at UNC, we've worked with many of them who over the past 10 years have been very interested in getting solar panels up, but it's just been difficult. And so this bill goes a long way to making that possible. The other thing that's interesting is Black, Indigenous, and Latino people, whether in rural or urban places, are more likely to be exposed to air pollution across the United States, and including in North Carolina. And the promise of this bill to push forward the decarbonization of our transportation is another opportunity to prevent health problems because of bad air for Black and brown people.
Why are Black and brown people exposed to bad air?
Well, in the places where most Black and brown people live tend to be closer to highways, closer to manufacturing, and all these contribute to poor air quality. And so one component of that air quality, a large component, is particulates that come out of gasoline and diesel combustion transportation. Mm-hmm. And again, this is not a short-term thing. It's going to take many years to really change the look of the transportation fleet in the United States. But this will have a disproportionate impact on the health of Black and brown people. Maybe a couple last things I want to throw in there. North Carolina just landed a lithium battery manufacturer. Mm-hmm. There is also a lithium mining company that is planning to do work in North Carolina called Piedmont Lithium. And so I just want a little caution that this is going to be different for people here. We haven't had to think about the kinds of things that Texas, California, and other countries have in terms of exploitation of fossil fuels. But renewable energy, it's not without environmental impact. Yes. And we're probably going to be grappling with some of those issues here. And then lastly, I agree definitely that there's great opportunity for jobs. My concern there is similar to the tech industry. As we ramp this up, as we're throwing billions of dollars into what will be a growing industry, that Black-owned businesses and Black workers are not going to be the ones that are getting the middle and higher wage paying jobs. Mm-hmm. And so we're at the front of this. I'm just hopeful that we can be very cognizant of this and figure out how do we get Black-owned businesses plugged in so they can grow with what's going to be a huge opportunity for a lot of people.
Mm-hmm. I hope so as well. And that is such an important point that you made, Dr. Little. Want to take us on to affordable housing because it's directly tied to what you just talked about, these great high-paying jobs that are coming here and people who have the deep pockets to afford more expensive housing. So housing is more expensive. Why not? Senator Murdock, how is affordable housing increasing under this bill?
Yes, definitely would do a lot of work to increase affordable housing, and do have to touch a little bit on the investments that it will make through HUD. Recently came from a national conference where had the opportunity to hear directly from Secretary Marsha Fudge, and she is really excited about this provision in this bill, and not to only equate affordable housing with HUD, but do just have to highlight we just have so much work to do right here in Durham. Our inability to maintain McDougal Terrace, one of our largest public housing units, made national news. We were having a lot of issues and concerns there, and so when you talk about infrastructure, that does include housing, and just so many of those properties across the nation, including here in North Carolina, are just so due upgrades. A lot of them will have to be completely rebuilt from scratch. So really excited that it will include long-term investments that we really need, for the lease of these, for folks that really have no choice but to utilize these federally and state subsidized programs for housing. So really excited that we will provide those investments that we really need, in addition to, other voucher programs and other ways that you can provide housing that aren't kind of what you traditionally think of as affordable, and even enticing more landlords to say, if you have, 5-6 homes that you own, how can we do a better job of making sure that we get more folks in need in those properties as well, since we are phasing out over time kind of the really huge, properties. We're getting more into more mixed, where, you may just have a few homes in a neighborhood and you don't know that they're affordable and that they're working with, some sort of voucher program. So as we continue to trend more in that direction, Build Back Better will provide those investments into. Wholeheartedly agree with what Dr. Little said. I think with all of these investments, we just have to really be upfront about the need to make sure that the disbursement of these funds are equitable, and the same goes for housing. It can't just go to, certain groups and certain people. We have to make sure that we don't leave out Black and brown people as we are distributing these funds.
Yeah, exactly. And I think that everyone has to simply be paying very close attention. Thank you so much. Mm-hmm. Every December, children all over the world look forward to having this man come down their chimneys with a bag of toys and goodies. Santa Claus is the delight of the season, and he looks like this, usually. Today, we're seeing more Santas who look like this. And I want to ask, what do you all make of it? I'm going to open up with you, Dr. Little, the Black Santa.
My best friend, who is Chinese American, lives in D.C., 3 years ago, spent all this effort to find himself a Black Santa so that he and his family could visit and get pictures with him. So even before this current wave, I think there are a number of people of all colors who are going to be excited about having different Santas out there. Mm-hmm. I'll say I didn't grow up in a household with Santa Claus, but I looked at Wikipedia and looked at Saint Nick. Please do so, because the actual Saint Nick is a pretty cool dude.
Yes, I mean, I can only imagine watching the Raleigh Christmas Parade. Now here's real change in diversity. You're watching the Raleigh Christmas Parade, and at the end, the finale is Santa Claus, and he's Black. When does this happen? They're already doing it at Disney parks. Mm-hmm. They're presenting Black Santas. Steve, you're Indian, of Indian descent. Does it matter to you? What do you think about it?
I mean, no, I'd love there to be an Indian Santa. Mm-hmm. I mean, what if Santa was like, sort of like different people play Santa every year? What if Santa, well, first of all, we're looking forward in Morrisville to welcome Santa. It's not easy to bring reindeer and a sleigh into RDU airport space. But, on a serious note, I think it's no different than having a Black Annie, which is wonderful for the Annie Live, or with James Bond, we want to recast James Bond to be someone different, whether they're Asian or Black or whatever, Latino, and why not with Santa? I mean, I think we there's always an assumption that Santa Claus is this white man. But I think now in a global economy, we should think out of the box, and I think it's great to change it up, and I commend Disney for this and the stores, and I would, but I do want an Indian Santa.
Yeah, I haven't seen that yet, so let's just broaden it on out. Senator Murdock, what are your thoughts? Is Black Santa going mainstream? Do you think that we'll see? You think white parents would be just as ready to stand in line and have their children photographed with a Black Santa?
I think they will, and you are definitely seeing it. I mean, from Broadway to Disney, you are seeing just more diversity. Representation matters, particularly with children. I think the earlier that children are exposed exposed to, a myriad of different races and cultures, the better. I grew up in Greensboro, North Carolina, and we always had breakfast with a Black Santa at Bennett College. And so I grew up with that, and it meant so much to me. I still cherish those photos. And I think particularly when it comes to these iconic figures that children look up to, they really, really need to see themselves in these people. And so that is why I'm all for Black Santa. I wouldn't go as far to say that it's mainstream, but I am glad that we are seeing more of that, because representation really matters as far as the way that you develop your sense of self. I think it can have a huge impact for young children and young people to see that.
Yeah, I think so too. I just remember being young and Santa Claus was Santa Claus. I actually didn't think about the color, but representation does matter. So Mark, what are your thoughts on representation matters and what kids really are looking at? Got about 30 seconds.
Yes, I think there's two things. Yeah, two things here. One, absolutely agree. Having more people looking different is important for everyone. So it's maybe important for my kids to see someone who looks like them, but it may be also important for other kids who don't look like Black Santa. It's like, oh, Black people they're friendly. I can sit on their lap and not worry, and they give me gifts. All that is really important.
Yes.
The other
It's
thing,
all
though, I
good.
think
Anybody who's giving gifts, with permission of the parents,
Yes.
is okay.
Yes.
So
Yeah.
I appreciate you
they're
all's
friendly,
feedback
safe.
on all of that. Senator Natalie Murdock, Steve Rao, Dr. Mark Little, thank you so much for being on Black Issues Forum.
Happy holidays,
Thank
everybody.
you so much, Deborah. Happy
Thank you.
holidays.
Happy New Year.
I want to thank today's guests, and we invite you to engage with us on Twitter or Instagram using the hashtag Black Issues Forum. You can also find our full episodes on pbsnc.org/Black Issues Forum, or listen at any time on Apple iTunes, Spotify, or Google Podcasts. For Black Issues Forum, I'm Deborah Holt-Noel. Thanks for watching.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting PBS NC.